Hi, I'm Deb Dietz with SMB Digital Education, and welcome to our YouTube channel. Today, we're sharing a sneak peek at the Raising Confident Parents online course, where our pregnancy and infant care experts, Pam Jones and Pat Pori, teach you what to expect during pregnancy, how to prepare for labor and delivery, and what to do once you bring the new baby home. Today we're focusing on Module 4, your hospital stay. And in Module 4, there are 5 lessons: hospital hints, common parent questions, adjustments, how to introduce your newborn to their siblings and the family dog. Lesson 4 are before going home questions, and Lesson 5 is postpartum complications. So here's a sneak peek, a quick look at Lesson 5, Postpartum Complications, where Pam Jones interviews new mom Dr. Catherine Taylor about her post-birth postpartum complications. It's a story you need to hear. It's a cautionary tale that typically after the birth of a baby, everyone is so focused on the well-being of the baby, making sure the baby is sleeping well and eating well, that sometimes issues with mom go overlooked. Here's Catherine's story.
Expectant parents did watch the video about possible postpartum complications in the class before our interview, so they have a little bit of an idea of what we may be talking about. And can you just tell us about your postpartum experience?
Sure. So I had my twins about 6 years ago, and prior to that, I had 2 daughters. They're singleton pregnancies. I had really normal deliveries and recoveries with them. So I had a really smooth pregnancy with the twins as well. I went all the way to 39 weeks and 1 day, which was pretty much as far as you can absolutely go with twins. So I didn't know a lot about complications. I didn't really even know quite what to look for. So I went into the births, and the doctor had recommended me for a vaginal birth because I had had 2 successful vaginal deliveries, and the babies were both head down. So I delivered in the operating room, but anticipated a vaginal birth. My daughter, twin A, came out within a few minutes vaginally. But when I went to go push twin B out, my son, we started to hit some complications, and long story short, we had to go into an emergency C-section. So, the recovery from that, both a vaginal and a cesarean delivery, was obviously a lot, and not something I quite knew how to wrap my head around and anticipate, and especially because I was coming home to, 4 kids, 5 and under. So it was kind of a lot to take on. And but my recovery process in the hospital was pretty normal, I would say. I went, stayed the average 4 to 5 days after the cesarean to, be monitored and make sure everything was okay. I did have a hemorrhage during the birth process, like when the placenta was coming out. So I was aware of that. But other than that, I was just kind of told the standard, if you're bleeding, call us and whatnot. So I didn't really know what to expect. So I went home, had the first night at home with the kids. And then the next afternoon, I was actually reading to my oldest daughter a book on the couch. And I remember reading to her, and I started to feel like I was losing vision on the right side of my eye. And I kept seeing these flashing lights, and I couldn't see the words anymore. And I'd never had that experience before, and I didn't, really know what was happening. So thankfully, Pam, you were there helping me take care of my kids. And I just remember going up to you and saying, I think something's wrong. I can't see. I was not smiling, though. I had a look of panic on my face. And
you were one of us smiling.
I was like, I can't see the pages. I can't see the words on the pages. I'm having trouble seeing. So Pam was, very calm, told me to go ahead and lay down. Luckily, knew or had a suspicion of what was going on, and sent my husband out to go get a blood pressure cuff from Walgreens, which is down the street from us. So I was laying on my bed, and Brian came back about 10 minutes later, like rushed in with a blood pressure cuff. And I just remember like my heart was racing and I was still having trouble seeing, and I got clammy and just like wasn't feeling, I knew something was wrong, and took the blood pressure and it was like very, very high. I mean, I think it was like 180 or 90 over 200. I mean, it was like really high. And remember, we called the doctor, Brian called the doctor, and the doctor said, if you have to, drive on the side of the road, but get down to Northwestern. So, you know, I headed down, and they readmitted me to the hospital. And, you know, upon further evaluation, you know, they wanted to make sure something wasn't going on neurologically. So, you know, I did like MRI and CT scans, and they did a bunch of blood work and stuff, but they diagnosed me with preeclampsia. And I said, like, I thought like that was only during pregnancy. Like, I didn't realize it was something. And they said, no, it can happen. And like, I forget the exact number, but I want to say 20 to 25% of cases can actually happen post delivery, which I wasn't aware of. So I stayed in the hospital a while longer. They gave me a magnesium drip to help, you know, vasodilate and, you know, get everything going. And once I was able to get my blood pressure regulated, they sent me home on blood pressure medications. So I had to, you know, keep that under check. And then I went in once or twice a week for a while. I'd say for 3 to 4 months for blood pressure checks, because it would occasionally just start spiking again. So it would just sort of similar situation where I would be completely fine, and then all of a sudden it would kind of go back up again. So, but there were a lot of silver lines in it. I really learned, I learned a lot about, like, you know, recovery, and there were things that I had not experienced in my previous pregnancies that I started to learn about and understand. And I really also started to learn how to, as a clinician, I knew how to talk to people about mindfulness and, you know, staying calm in a difficult situation. But it's another thing to really have to like apply that to yourself, especially while you're busy trying to take care of kids and figure all that out. So there were a lot of tips and techniques that I learned to really get that help, and that I needed to kind of let my body and my mind recover from everything I had gone through. So I'll pause there and see if you have a question, and I'm happy to keep talking too.
Oh, sure. Well, you know, and that is the problem, you know, one of several. You know, you're a very educated mom, a very educated woman, and you didn't know that something like that could happen when you get home, when you got home. And, you know, when we all come home with the babies, you know, all the attention's focused on the babies. Is the baby okay? Are they eating enough? And so everybody seems to kind of forget about the mom. And, you know, well, her work is done, you know, she's fine. And so what I was finding, you know, over the years, especially after your situation, that so many new moms that came home had no idea about the complications that could happen once you came home. And it was really scary because, you know, you being very educated and already being a mom, you know, makes me even more worried about, you know, maybe moms that are not so educated, first time moms, moms that don't have support. And they're, you know, they're seeing things, but they're, oh, well, no, it's nothing, you know, it's nothing. Because I even remember very clearly you saying to me, I think I have a migraine. I'm going to take an aspirin and go lay down. And me say, no, you're not. And you're like, why not? And so, you know, it just worries me so much that, you know, since then, and we've had so many moms that I've talked to that, you know, don't know that you can have postpartum preeclampsia, don't know what to look for, you know, headaches, blurred vision, you know, upper right-sided upper gastric pain behind your ribs, you know, dizziness, even, you know, subtle things, you know, just lightheaded. I mean, yours kind of hits you like, okay, yeah, I'm sorry, this is not a migraine. We're not going to give you aspirin and pack your head with ice. You know, if the blood pressure cuff comes back and you have low blood pressure, okay, but we're going to make sure. And, you know, there's just so many moms that don't know. And that's what really worries me. And, you know, that's why, you know, we've been doing videos, we're doing classes, we're trying to get the information out there.
Such great information, and information that's not well known to new moms. To learn more about Module 4, your hospital stay and getting ready to go home, click the link referenced in the description of this post. And please, I invite you to like the SMB Digital Education YouTube channel so that you can get notified every time we put up a new video. Thanks for being with me today. I'm Deb Dietz with SMB Digital Education. We'll see you soon.